Welcome back. Right now we'll be going to Kaduna to speak with the executive governor of Kaduna State, Malam El-Rufai. Good morning, sir.
Good morning.
First of all, we'd like to congratulate you on your recovery.
Thank you.
All right.
Thank you very much.
All right, sir.
It was a miracle, but yes, I've fully recovered. I'm not back at work yet, but I'm okay. I'm fine.
All right.
As you can see.
Thank you. Thank you for sparing time to do this. The first thing we want to ask you, just for general knowledge, because the whole country is watching this, and for informative reasons, what has been the broad outline of Kaduna State's response to the COVID-19 pandemic?
Well, the moment this pandemic was declared a global health emergency, our team of technocrats and public servants in Kaduna State brainstormed and determined that we are going to face, as a state as well as the country as a whole, a trilemma, a choice between what to prioritize. Is it lives, livelihoods, or liberty? And we concluded that COVID-19 is both a public health and socio-economic emergency, and we have to choose what to prioritize. And in our own case, we decided that we will prioritize protection of lives, because livelihoods can be rebuilt when destroyed. Liberty can be restored when lost. But life, once lost, can never be recovered. So our strategy from day one was centered around what steps do we need to take to protect the lives of the people of Kaduna State. And we decided that we do. It did not matter what it cost us. We will do whatever we can to protect the lives of the people of Kaduna State. We'll inconvenience people and apologize later. We'll affect livelihoods negatively, but we'll apologize later and try to rebuild those livelihoods. So our strategy from day one was, how do we ensure that this virus does not spread in our state? Because our public health system has no capacity to handle it. The entire number of ICU beds in Nigeria at the onslaught of this pandemic was 350 for the entire country. And in Kaduna, we just have like 20 ICU beds. So how are we going to handle the situation if we have 1,000 people requiring treatment? So we knew we couldn't handle it. So our best strategy was to ensure that we prevent the spread of the virus. So we're the first state to lock down. We are one of the first states to close our schools, because we realized that it is only through ring-fencing our state from this other states that will import the virus that will be able to protect our people better. And we also realized that this is an opportunity to strengthen our public health infrastructure. We are in the process of building a permanent infectious diseases hospital. The one that we have is just 16 beds. We are building a 139-bed infectious diseases hospital, which will be completed in the next 8 weeks. We are building infectious diseases wards in each of our general hospitals, in each local government, each of the 23 local governments. This will be 20 to 30 beds in each of the local governments, but the main hospital will be here in Kaduna. And I want to say also that we realized from day one that the key to containing this pandemic is to do what we call the 3 T's. Trace, whenever there is an infection, trace everyone associated with the person infected, test, and then treat. Now, when this thing broke out, we did not have a single testing center in Kaduna State. Today, we have 2 that are working, and so far we've tested nearly 400 people. We hope to have a 3rd one commissioned next week. The equipment was installed yesterday, and we hope NCDC will certify it okay during the week, so that we have a 3rd testing center. Also, we are bringing in mobile testing centers that can go into every part of the state and test people in the event of community spread. And we believe that by the time we have all this in place, we're expanding our treatment facilities. As I said, we have taken over an hotel and converted into a treatment hospital. We have a third treatment hospital and isolation center at the All Pilgrims Camp, where we are camping the Almajiris. As I announced some days back, we received 169 Almajiris from Kano, and so far 21 of them have tested positive. We expect more to test positive over the days. In fact, the spike in our numbers have largely been the Almajiris and other people that have come to our state. So we have been successful in closing down our state, in reducing the traffic into the state, and each and every case of COVID we've had in the state has been imported. I was the first case, I was the index case. Fortunately, I would say, because it served to scare everyone into the state to come up to the reality that COVID is real. It's not a joke. I was the first case, and I got it in Abuja, and I infected 4 other people. Happily, all of us are okay now. We are all back to our normal lives. But that is the broad outlines of our. But in addition, we also took extraordinary steps to get PPEs for our health workers. We didn't want to expose any of our frontline workers to any risks, so we have a lot of PPE for all our health workers. We've also insured their lives to the tune of 5 million. Anyone that dies in this process, his family will get 5 million naira. And we have also additional disability insurance for those that get sick, cannot work, but no death. And we are also giving a special allowance to all health workers, as well as extraordinary allowances for those on the front line. So this is the broad strategy we've adopted in Kaduna State, and we're implementing with all energy and focus.
All right, sir. I'll take the second question, particularly from all you have said. Kaduna State government's efforts has communicated that it focuses to ensure that as few people in the state as possible get infected by COVID-19, with the emphasis being on prevention, because it is the prudent thing to do to save lives, given the limited capacity of our health system. Now, so the question is, there is a broad paraphrase of your words, all right, of the speech you gave announcing your recovery, and it does seem to be working. However, the numbers show also that a significant portion of the population are vulnerable and are unable to make a living due to the quite necessary lockdown. So let's talk about Kaduna State. How have you been supporting the less privileged during this lockdown?
Yes, well, from day one, as I said, we realized that the lockdown will affect livelihoods. There are people in our state that make their living from day to day. They do not have the security of a monthly salary. They are in the informal sector. 60% of Kaduna State's GDP is from the informal sector, the petty traders, the transporters, the daily paid laborers that work on construction sites. So in designing our lockdown, which we refer to in the quarantine order as partial lockdown, we designed it in a way that our construction companies, for instance, will keep operating. So all our road works, all our construction works are exempted. They are considered essential services, and the workers of those companies were exempted from the lockdown. So construction works continued. That way, all those employed in the construction industry will continue to have jobs. We gave badges and exemptions to the construction companies to continue working. That is one. Secondly, we exempted food, grocery stores and pharmacies from the lockdown. That is a significant portion of our informal sector, because most of our petty traders are in this business of selling food and groceries. So we exempted them, and they are allowed to operate to a large extent. Again, that has taken a large chunk of the informal sector to still be working. But we also estimated that in Kaduna State, between 20 and 30% of the population is vulnerable and will therefore require food intervention. We therefore drew 500 million from the contingency fund of our 2020 budget and bought food items and packaged them and targeted 9 urban local governments, because most of those that are vulnerable are the urban poor, those that came from the rural areas to the cities looking for work, and they have to work from day to day to earn a living. So we targeted the 9 urban local governments, and we spent 500 million plus other food donations from other good-spirited people, and we shared that. Now, that was a challenge, because identifying who is entitled, who really needs this, is a problem, because we have no database of poor people that we can rely upon. We tried to use the national social register that is used to give the monthly 5 or 10,000 from the National Social Investment Office, but it was not adequate. We therefore relied on community leaders. So in each cluster, we appointed a committee headed by the village head or the district head, with the pastor and the imam from that cluster, with representatives of women's groups and youths, to identify within their communities who is entitled to this food intervention and distribute. It has worked in some local government, has not worked in some. Some of the people we trusted abused that trust and didn't do what they were supposed to do. We learned our lessons. However, we are now planning a second round. So we intervened. We provided food to those that cannot have food unless they go out to eat. We tried to do that. It has been reasonably helpful in lowering the needs of the people. We are planning a second round now in May. We did that in April. The second round in May, I'm happy to say that we are spending, or we are distributing food of approximately 2 billion naira to all the 23 local governments. The largest donation of food came from Kakobit, the private sector group led by Aliko Dangote and others. They are providing 900 million naira worth of food items to Kaduna State. Our public servants are contributing about 700 million. The state government has raised 200 million from other donors, and we are matching what our public servants are going to have sacrificed to ensure that we have 2 billion naira that covers all the 23 local governments. And this time, we are not trusting communities to pick who is entitled. For communication and digital economy, we've obtained data of the poorest people in Kaduna State using their phone recharge purchase records. So we believe that anybody that spends less than 200 naira per month on buying recharge card for his phone is poor and will need this food intervention. And we'll have your phone number, we know your address, we'll just call you and deliver the food items to your house. So we hope that this second round will be more targeted. We'll get to those that are really, really poor from their phone records. Of course, there are those without phones at all. They are so poor that they don't even have phones. And we rely on communities then to identify those. And our hope is that this will help. But on the whole, as I said, our lockdown was designed in such a way that a significant portion of the informal economy still operates. For instance, we open the state twice a week, 2 days in a week for people to restock. But when we noticed that the markets get congested on those days, we decided to close all the major markets. We borrowed a link from Lagos, actually. We are closing all the major markets. We have established temporary markets that will start operating today in our public schools and other public facilities, so that we maintain physical distancing. We ensure that everyone wears face masks, and there will be wash points where you can wash your hands and maintain hygiene and so on. So we started that experiment today. But our lockdown did not deprive people completely of their livelihood. Some have been deprived, but a significant portion are still earning a living. So that has been our approach, and we think it has worked reasonably well so far.
All right, sir. I will ask one more question. The first one, you have spoken about prevention, conscious about the health of your people. The second one, about the program for the poor. But listening to you, I've heard you speak about government being a perfect science, that you run your government in a scientific way. And I'm sure you are also a person who believes in business and commerce. So what we want to ask in terms of business is that we want to ask about your thoughts concerning the impact and the economic effects that this is having upon your economy, the state's economy and finances. What are on the plans you had and forecasts for 2020? So what are your thoughts on the economy post-COVID, particularly with the drop in oil price, which might affect revenue?
Well, this is a major problem. But you know, this crisis is also an opportunity. For long, Nigeria has been saying we need to diversify our economy from reliance on oil. Well, this is the time. Oil is down to $20 a barrel, maybe 30 at best, and it's not going to take us anywhere. For Kaduna State, that relies on Federation account for 50% of its budget, it is a major challenge to see oil prices crash from $60, $70 a barrel in January to less than $30 now. It will have a major impact on our economy, and we need to now start thinking of diversifying. For us, the post-COVID economy will be a different kind of economy. The new normal post-COVID, when we get out of this, and I know we'll get out of this by the grace of God, will open up opportunities in other areas. Many industries and businesses will take such a hit that they may never recover. Hotels and tourism and such businesses are going to take a big hit. Transportation, aviation are all going to take a big hit. However, there are new areas of new businesses that will be able to absorb people with the appropriate skills. For instance, online businesses, online grocery stores that you order your groceries online and they are delivered to you. The logistics delivery business will thrive. New businesses should come up. And here in Kaduna State, we're actually encouraging the emergence of logistics businesses, because we don't want people going to the market now or even after post-COVID to be going to the market and mixing too much, buying groceries. You can order online and it can get delivered to you, which requires enhanced internet connectivity, but the investments are being done. As a government, we have to operate online. It's almost compulsory now for all governments to move towards e-government completely and e-services to citizens. Education, a lot of education has to change and be online. Telemedicine will emerge and thrive, and we also see an opportunity to provide liquidity to our small and medium enterprises and connect them to global value chains, so that what we produce not only can be consumed in Nigeria but exported. But for a state like the Kaduna State, which is a leading agricultural state, we are the leading producer of at least 4 or 5 commodities: tomatoes, maize, soybeans, ginger, and sorghum. We are the leading producers. We produce 23% of Nigeria's maize. This is a great opportunity to expand production for the domestic market as well as exports. So post-COVID, industries are going to change. There will be major shift. There will be creative destruction of some industries, but the emergence of new ones. But what is very, very important, the need to educate our people, to ensure that they are healthy, and to ensure that they have skills, particularly ICT skills, digital skills. And I'm proud to say that Kaduna State is one of the leading states, at least the leading state actually in northern Nigeria in terms of imparting ICT skills. We have an ICT hub that has trained hundreds of people that are already making money online from ICT and other related businesses. So that is our view of the future. That is what we are working on. And our Ministry of Business, Innovation and Technology is working around the clock to ensure that will prepare for that post-COVID future. Finally, our State Executive Council has formed a committee, a subcommittee, to start working on scenarios of relaxing the lockdown. As soon as we have a handle on the infections in the state and we have a map of community spread, we have enough testing capacity, we are going to relax the lockdown gradually, particularly in light of the fact that the rainy season is around the corner and we must produce food. So we have strategies in place. Government is not a perfect science, I must say. We think through issues, we come up with what we think are the solutions, and we try to implement with focus. But as we implement, we tweak here and there when we see mistakes or we get better suggestions. And in this matter of coronavirus, everyone is guessing. It is a novel thing. There isn't enough data. There isn't enough policy choices. There aren't enough studies for anyone to make perfect decisions. But what is important is to prioritize what you want to achieve and decide and be decisive, and then make adjustments when you realize that something that you thought will work is not working. And that's what we are trying to do in the Kaduna State government.
Thank you very much, Your Excellency. We would have loved to tap more into your intelligence, but we have run out of time. Anytime in future, we are sure we'll link up back to you. Thank you very much, and thank you for the good work you are doing in your state. God bless you.
Thank you for inviting me. I'm very grateful.
All right, thank you.
Thank you.